Hi everyone. So if you guys look around or if you guys think about it, healthcare is one of the most essential things for people. And why is that? You need health insurance in case you get injured or in case you're really sick, or for many different reasons. However, for those of you guys who know about the Affordable Care Act, there are the bad side to it. It's not only just about benefits, about what it can do for people, but people have to really think into what they're really investing in. So Obamacare has actually the largest tax increase in history. It has 21 separate tax increases and new taxes, 75% of which hit the middle class, and $500 billion in total tax hikes. So if you think about it, there's so many taxes on it. There's investment income tax, there's medical payroll tax, there's special needs kids tax. All these taxes just keep adding up and build up. And this is actually one of the biggest government spending programs in history, with $1.2 trillion plus when we're already on the verge of bankrupting. So if you think about it, like right now, America, we are on the verge of debt. But if we continue to invest more money on health insurance like this, who knows? In the future, our kids, grandkids will be suffering more in debt, and our country will not be progressing and getting better. So some of the concerns about Obamacare is that employer mandate incentives actually have been shifting the workers to part-time because employers are not required to provide health coverage to part-time workers. So this makes people not be able to support their family as much because they aren't getting enough hours and as enough money and income for their families. So that's a very big problem. A lot of employers think it's okay that they can make their workers shift from full-time to part-time. And also, according to a study completed by the Association of American Medical Colleges, America is projected to have a shortage of 91,500 doctors by the year 2020, due in part to an overwhelming negative view that many have on Obamacare because of the cut of hours. And in fact, a survey completed by the Doctors Company found that 60% of doctors feel that the pressure to reduce costs, increase volume, and improve quality will have a negative effect on patient care. This will cause 43% of physicians to also contemplate early retirement. So this is not only affecting families, this is also affecting doctors. They tend to want to step out because they don't want to deal with having their hours cut or with paying more taxes. Also, according to a Kaiser Family Foundation Health Tracking poll, 42% of Americans in general are unaware that the law is being implemented, while 51% of Americans ages 18 to 29 are unaware that the bill was signed into law in March 2010. So you can see here that people aren't really informed of the law completely. They know that there's benefits, they know that it's health insurance, but they don't know that what they're getting themselves into when they've already invested in money. So Obamacare isn't just, it may seem like it's a health insurance, but there's a lot of sides to it that people don't know, people are not aware of, families are affected as well as doctors are. And but setting aside, Obamacare is also filled with 3.8% surtax on investment income and 0.9% surtax on Medicare taxes for individuals making more than $200,000 and families making more than $250,000. So when families earn that much amount of money, their taxes increase. And new taxes that apply to flexible savings accounts and health savings accounts are also put into play. So as you see here, there's more and more building up. And of course they're not going to mention it to people. They want to make it seem like it is a very good investment, but this is actually taking a toll on America's debt and people who cannot afford as much money in U.S. households. Also, Obamacare is also filled with cross-subsidies, a way of transferring wealth without using a tax code. So for example, it requires health insurers to accept people with pre-existing conditions, which mostly affects individuals buying their own coverage, and puts a cap on how much insurance can charge. It is a popular provision only because most Americans don't realize they will be paying higher premiums. So in order for individuals with pre-existing conditions to get coverage at less than the actual rated risk, young and healthy people must pay more than their fair share. A lot more, actually. Many of them will want to drop coverage because it will be so expensive that it's hard for Obamacare to try to force them to stay in. But even if everyone is in the health insurance, which they probably won't be, the young and healthy will spend a lot of money paying higher than necessary premiums to cross-subsidize others. So you see here it affects people of all kinds. It affects parents trying to support the kids. It affects the young adults, people who are trying to start their careers. It affects also seniors as well. And it requires all individuals to buy government-approved health insurance plans, which imposes new mandates that will raise individual insurance premiums by the average of $2,100 per family. And also, as I said, forces younger Americans to pay double-digit premium increases so that older workers can pay less. But if you think about it, it's not fair. People who just start off their career, the younger Americans, they may be struggling with financial problems, and for them to pay more, it's just going to be harder for them, to support their own families, who probably are retired, to support maybe kids. Who knows? Maybe some people have a family already by that early age. So it's not okay to also force the younger Americans to pay more, just so older workers can't. It should be fair. It should be equal, and this toll also allows, the health insurance, another factor of it is that it allows individuals to purchase insurance on government exchanges and to receive taxpayer-funded insurance subsidies without verifying as American citizens. So that's also a problem too, because when you're not really an American citizen and you can just have the health insurance, it actually raises the more people and more tax. So yeah, there's a lot of concerns, and that people should really look into what they invest their money on.